Hi, Mr. Simpson. Come on in and sit down and have a seat. The reason I've asked you to come into this side room is because my assistant was telling me you have quite a few scripts or quite a few medications that you've never had before, and she thought it would be a good idea if I just went through them all with you and explained exactly what they're for, and give you a bit of background on the medication so you know what to expect. Okay, so I have your scripts here. There's one for yourself, one for your wife, and one for your daughter, is that correct? Yeah, okay. The first one I'll deal with is, I have a bag here of all medication for you. So the first one your doctor has prescribed for you is omeprazole. This is it here. Comes in a box of, let me see, I'm not sure if it says. It's 20 micrograms, one to be taken each day. Obviously, you know, to swallow the medication whole and not to chew it. Obviously, but we have to say these things. There's 28 in a packet, so it's a month's supply. And they come in a little silver foil package. Just press out each tablet each day. Omeprazole is used primarily for acid reflux. If obviously you have GORD, is that correct? Gastroesophageal reflux disease. Yes. You get a lot of discomfort and a lot of heartburn, things like that. Yes. Well, these will reduce the amount of acid in your stomach, so therefore it won't, you know, come back up the esophagus and into your mouth as it has been. Hopefully you should get some relief from these. Yes, so that's that. Now the next one on your list is the reason basically why I called you in here, and I didn't want to say in front of the whole pharmacy, excuse me. It is Lyrica pregabalin. I say the generic as well as the brand name because a lot of people would recognise them from the past as the brand name. Say, for example, paracetamol suspension would previously be known as Calpol, you know, things like that. So we like to try and come away from the brand names because there's so many different drug companies and we don't want any one to become a label, so we've started to use the generic name. So if you could quote the generic name on your repeat script when you come, that would be more helpful. These are, how to explain, they're actually a painkiller. They're for like sciatica, things like that. They help treat neurological pain, really, but they can also be used for several different things. They can also be used for epilepsy, or in your case, they are used as sort of a tranquilizer. They calm people who have anxiety disorders. Have you got an anxiety? You do? Okay. They're basically a mood stabilizer. Is it anxiety, bipolar? Okay. Yes, they're used as a mood stabilizer in bipolar disorder. They help to stop episodes of mania or hypomania, and obviously to keep the person yourself on an even keel, as opposed to going very high and very low. The third one for yourself that you have to take alongside these. I'm sorry, I forgot to tell you when you have to take them. You have to take one twice a day, so once in the morning, once in the evening. 75 micrograms of them, and they can make you drowsy, and to be honest, they can have some quite serious side effects. I would be careful when taking them not to be doing any, committing yourself to any kind of responsibility. They can make you quite trying to think of a professional way to describe it. They can make you very drowsy. Sometimes you may hallucinate, things like that, but it will only be maybe in the first week of taking them. It should calm down after that. These ones here, these are duloxetine, or the brand name Yentrive. 20 micrograms, take one per day. These are an antidepressant medication, taken alongside the pregabalin. They work on the effects of bipolar disorder, borderline personality disorder. I think that's maybe it. When they're used together, I think that's maybe the only mental health issues that they would deal with. Again, these can have some side effects. They shouldn't be too serious. I mean, you may be a little bit frightened, things like that, because it can exacerbate the effects of bipolar disorder sometimes in some people. It can make some of your symptoms a bit worse for a week or so. So just be aware that it's the medication and that you're under no harm at all. So they come just simple. They actually tell you to take them day and night on the case there, which is quite helpful. If you need any more information, there is always a leaflet inside the pack that you could read, which may give you a bit more advice than I can. Or if you're really stuck, you can ring your GP, obviously, or you can Google any information you need to know. Obviously come to me first or whatever, but a lot of people choose to use Google. NHS Direct is usually one of the best. The next one for yourself is cyclizine. These are an anti-sickness medication. Some people, when they take these two, can get quite nauseous. Cyclizine can help. Oh, okay, so these, your doctor prescribed these for the the GORD. Yeah, okay. Well, when you feel ill, when you feel nauseous, and obviously, you know, there's a degree of nausea where, you know, you have to use discretion. If you're going to be sick, don't take one. That's not going to stop that. If you feel slightly nauseous, I would take one. They're prescribed. Take one every 8 hours or 3 times a day. That's the maximum dose, but I know you don't have to take them as often as that. So the final thing for yourself is Gaviscon, a big bottle of Gaviscon. This is for the GORD again. This is totally safe. It can be taken by pregnant women and women who are breastfeeding, so it's great for when you have symptoms of heartburn that maybe your medication, which takes quite a while to work, hasn't quite worked yet, and you need something instant to take the acid out of your throat. This is great, and you can take, it says prescribed to take 1 or 2 5ml spoonfuls to be taken 3 times a day after food and at night when required. I would just say take it whenever necessary, basically, and it will give you an instant relief from heartburn. So don't put it in the fridge is a good piece of advice that I'll give you, because it won't come out of the bottle. It's very, very thick. Okay, moving on then to your daughter's prescription. Just simple Centrum Kids Chewable multivitamin. I believe she was feeling a wee bit under the weather, and the doctor prescribed multivitamin just to lift her a bit. So you can chew these. These are chewable, and they're absolutely delicious. So just gonna smell it. Yeah, I know, they smell really lovely. They smell like lemon or something. So just take one of them a day, just to increase the vitamins. Obviously, increase her vitamin intake in her food would be more beneficial. The next thing is just some it's just some ibuprofen liquid for anti-inflammatory purposes, sore heads, cold flu symptoms. It does work on a temperature as well. I'm not sure how. I know Calpol works on the hypothalamus. I'm not sure whether Brufen is the same, because I know they're two different medications, but that's that. Just take the Brufen every 4 hours if necessary. If she has a lot of pain, make sure you don't miss a dose, because it's good to build up Brufen and things like that, because it helps in the long term. The last script then was for your wife, and she had wanted the doctor to prescribe some kind of weight loss treatment, but she didn't qualify because her BMI wasn't high enough for the Orlistat medication. So the doctor has told me just to ask you if you want to purchase some items. They're not free, unfortunately, on the prescription. They're not free. So we have these. These are $19.99 if you're interested. These are citrus Arantium formula. It's a food supplement, or it basically, it's perfectly natural, all healthy ingredients that target your appetite. It's an appetite suppressant. It's also a detox, and basically just you know, like a tonic kind of for your body. So they would help with the weight loss. I know she's doing very well, eating a very balanced diet and that, but these obviously cannot be taken if you're not going to follow a balanced diet, because there's no point. They help with the weight loss, but they're not a wonder drug. Nothing is. So the second one is African mango food supplement, and they basically do the same thing, only they contain mango, which is known to help cut down fat. So that's them, and they are $24.99 for a month's supply. So if you're interested, there they are. You can take them to the front desk if you wish. I'll not push you on it. So that's everything. Just slide these up for you. As I say, you're not under any obligation to buy those, so that's okay. It was lovely to see you, and I wish you all the best with your medication. There you are. And anything you need, we're always here. We're Monday to Friday, 9 to 6. Okay? Okay, thank you very much. Bye.